Dr. Cooper, thanks so much for talking with us about a couple of things. We're focusing on the great work that you do at the Norton Neuroscience Institute. You also have a big upcoming event where you're kind of educating the community about things related to Alzheimer's, neuro, and whatnot. But today we're talking about specifically Alzheimer's and diagnosis, signs and symptoms. You've been doing this for quite some time.
I haven't. Thank you for having me.
So tell us a little bit about Alzheimer's. Just, I think a lot of folks know what it is, but just kind of the signs and symptoms, and is there a growing problem of this condition?
Yeah. So Alzheimer's disease is a progressive brain disorder, usually occurs later in life in our 60s, 70s, 80s. And we have progressive difficulties with our cognition, our memory and thinking. Now, early on, that's mainly short-term memory. We're more forgetful. We repeat ourselves more often. Long-term memory, memory from 20, 30 years ago, should be relatively good. We may also have other problems like difficulty with orientation, our ability to navigate, our ability to come up with words to express ourselves, and maybe our ability to plan and organize things. The important thing, though, is this is a change. We all have lapses every day. That's part of being human. But in this condition, we start to see progressive changes over time. And it is a big problem. It is the most common cause of dementia. Approximately or nearly 7 million people in the United States alone have this condition, and that's going to double in the coming decade. So it is a very common condition, and it's becoming more and more common all the time.
How do we diagnose Alzheimer's?
So it is still primarily a clinical diagnosis. It's made by sitting down with a healthcare provider and doing a careful interview, particularly with family, understanding the symptoms, doing an examination, and that includes doing some usually simple paper and pencil type tests of memory and thinking. We will usually do additional blood tests to rule out other medical problems. We'll usually do a MRI scan of the brain to rule out things like stroke. And then something that's really changing in our field right now are tests called biomarkers. These are tests, in this case, looking at particular proteins in the body that can tell us if someone is more likely to have Alzheimer's disease or not. And in the last few months, we've had the approval of blood-based biomarkers. So in the past, we had to do a spinal fluid exam, or we might do something called a PET scan, which is often not available. Now we have high-quality blood tests, if used in the right setting, can be very helpful for this. Now, they have to be, we have to be careful how we use those, but in the right setting, they're helpful.
So when someone suspects either they or their loved one is maybe going through dementia, Alzheimer's, actually, before I ask you that question, tell us the difference between dementia and Alzheimer's.
Yeah, that's a great question. I should have pointed that out to begin with. So dementia is a broad umbrella term. It means a change in cognition, memory, language, executive function, a change in cognition to the degree that we now need help with our day-to-day activities. I may not be able to manage my finances independently, for example. And then Alzheimer's disease is a specific cause of dementia. So anywhere from 60 to 80% of people with dementia, the underlying cause is Alzheimer's disease, but there can be other causes like vascular disease, for example.
Okay. So if someone suspects they are kind of going through that in life for either themselves or a loved one, I would assume that maybe if I was going through it, would I recognize it, or is it more something that people around me notice?
It's usually going to be what other people notice.
Okay.
And I always say this, and I know it sounds silly to say this, but if I have a problem with memory, I don't necessarily remember that I didn't remember something.
Mm.
So it's usually going to be my family that notices it. We always kind of say in clinic, if someone comes to see me in clinic today and says they think they have Alzheimer's disease, it is very likely they do not have Alzheimer's disease. On the other hand, if somebody comes in and says, I'm doing just fine, but my family's worried, that's when I'm going to be most worried. So it is going to be the family that recognizes it more often than not. And if there is that suspicion, I'd really urge people to get checked out. It can start with their primary doctor, or it can start straight with a specialist, a neurologist or a geriatrician. Um, it's worth getting checked out because in some cases we find that there's an alternative explanation. We may find something that we can treat and reverse it. That's the best outcome. But even if not, there may be things we can do to improve the symptoms or to slow down the progression. So I think there are a lot of reasons to take an aggressive approach and really try to get a good evaluation as soon as we can.
What age is the age range for most people?
Uh,
Um,
for the great majority of people, it's going to be over the age of 65 and really into the 70s. Now, that doesn't mean that there aren't people that have an early onset dementia, but that's much, much less common. So mostly over the age of 65.
any demographics that we see this more in men, women, African American, Caucasian,
Uh,
Hispanic?
We do. So it is more common in women, um, but maybe even more notable than that, among African Americans, the risk is double. Among Hispanics, it's 1.5 times higher than Caucasians. So, in some of those populations, the risk is significantly higher.
Um, so when someone suspects, okay, I think my dad is going through Alzheimer's, I call up your wonderful office, hopefully get an appointment with you, and what starts to happen?
So, once we have an appointment, the first thing that would happen is come in and we just sit and talk. And it's really important to have a family member or a close friend there because I don't want to just talk with the individual that may or may not be affected. I need an informant to tell me what they're independently observing. So I want to get both sides of the story. And then we'll do a brief exam. There's a general exam that takes a minute to do, but then we'll do a little more careful memory type testing, and that can take 5 minutes. It can take 15 or 20 minutes, but usually not too long. And 90% of the time, we know the answer at that point. We're going to do some additional blood tests. We're going to schedule a scan of the brain, and we'll get those scheduled. Most of the time, those are going to look pretty good. Occasionally, we still don't have an answer, and we'll need to do more specialized testing. For instance, these biomarker tests that I mentioned. But most of the time, we're going to have the answer by just doing kind of old-fashioned medicine, doing that exam in the office. Once we have a good idea of the diagnosis, then we're going to talk about our options for treatment. And we have some medications that we think of as cognitive enhancers. They just help with memory and thinking in general. And then, depending on the diagnosis, if the diagnosis is Alzheimer's disease, we may talk about this new class of medicine called anti-amyloid therapies.
Mm.
These are medicines that they're not a cure, but they significantly slow down the progression of conditions like that. And then I think ideally, if and we have the luxury of being able to do this, you'd like to be able to connect with other resources, educational resources, social support, those things, not just for the patient, but for the entire family. You really, it's not adequate to just run tests and prescribe a medication. You really need to have a much broader approach that addresses not just the patient, but the entire family, if at all possible.
It does impact the entire family.
It absolutely does. It absolutely does. And if we ignore that, we're not doing our job, in my opinion.
Okay. So we talked about how there's no cure for Alzheimer's, but there are medications that can kind of slow down the progression. So that means the earlier you start to see the signs and symptoms, the better off you could possibly be.
That is true. So what we know for sure is that these disease modifying treatments, these treatments that slow the disease down, uh, you're only eligible for them at the very early part of the disease when things are mild. So if somebody comes to see me and they've progressed through that to a moderate dementia, then they may not be eligible for those drugs. So that's true. What we think, and we have some evidence for, is even within that window of eligibility, the earlier the better. So I'm going to get out on a little bit of a limb here. We will tell people these medicines slow progression by about a third. But there is some early evidence that if we catch this very early on, that number may actually be closer to 50 or 60%. Now, we can't guarantee that. We don't know that definitively, but the point is there is some evidence for that, and hopefully we'll have more over time.
I think the world of you, and I love how much you do in advocating and helping people. But you guys are also doing that through your Neuro Expo that's happening soon. Tell us about that. That's something that you all have been doing the last couple of years, and it's quite popular and very informative.
Uh, it was amazing. I will tell you, and I did not start this. I was stunned when I moved to Norton and saw what a big deal this is. So it is an event for the whole community, and we're really trying to help showcase advances in the neurosciences, and we'll pick different tracks that people can join in. So, for example, for our part of it on Alzheimer's or dementia, we're going to have a talk on the stages of Alzheimer's disease. We're going to have a talk on different behaviors that may or may not occur, like depression or anxiety, etc. We're going to have somebody give a talk on these biomarkers, these tests that I talked about to help us make a diagnosis. And then I think something that's very interesting, one of my partners is going to talk about the difference between delirium and dementia. And without giving that away, these two things are often confused. Delirium is something we often see in the hospital when people have other illnesses, and it's often mistaken for dementia. So, a number of things that'll, I think, really give some good information for the community. It's really a great event, in my opinion.
Yeah. And it's open to everybody in the community. You were mentioning that. You just
Absolutely.
have to register in advance, I think, right? And
Correct.
get your seat so you can learn a lot. And it's not just Alzheimer's, it's also other neuro things that you all discuss.
Yeah, that's absolutely right. So, for instance, we like to do this when we can. We have a guest speaker coming up from Wake Forest, who's one of the real leaders in the field in migraine and headache. And so that, in addition to individual tracks, she'll be giving an address to the entire expo.
Okay. That's where I kind of got in touch with a lot of your doctors. I personally suffer from migraines, and you all got me on track with finding some relief in life. So I always will credit you all for the great work that you do. But the Norton Neuro Institute, you guys, your memory team is really a standout group in talking about research and a leader in memory care and brain health. Talk to me more about that. That's something really to be proud about.
So it is. Norton has really given us a lot of support and given us that challenge to create a center that not only our community can be proud of, but we contribute at a national or international scale. So some of the things that we've accomplished, we were one of the first groups in the entire country to give these anti-amyloid therapies, and we're still one of the leaders in that space. And because of our experience with that, we're able to present our work at the Alzheimer's Association's International Conference in Toronto this year. So that was a pretty big deal. In the last year, we got a grant to develop what's called a Brain Health Navigator program from a group called the Davos Alzheimer's Collaborative. And that's really helped set us apart as well. But more importantly than that, it's allowed us to innovate in a way that hopefully provides better care to our patients and to our entire community. And beyond that, we're starting to get attention from surrounding universities, research groups. I am now having meetings practically every week with potential collaborators, and it's an exciting time. We're not where we want to be, but we want to be at the very front of really serving our community, trying to be something that the community can be proud of, but also helping us strive for ways to better care for folks, their families, and ultimately find cures for diseases like this. That's where we want to be, and I've been very lucky to be at an institution that gives us the support to do that.
Absolutely. I want to talk a little bit more, Dr. Cooper, about because you touched on it, but really the impact that loved ones and friends and family go through when they're dealing with someone who's going through Alzheimer's. It can be frustrating, right? I've repeated something 100 times and you lose your patience, and
Yeah.
it can be hard on folks around them. But what should we keep in mind?
Well, I think probably the most important thing is patience. But listen to me carefully. Patience both for your loved one, but for yourself. Give yourself some grace. It is hard. And to pretend it's not hard isn't doing yourself any service as well. So I think be patient with yourself, give yourself a little bit of grace. And then also understand our loved ones not doing this on purpose. It's not their fault. And something I've always thought that's important is just because our loved one is having these problems doesn't mean that they're not filled with all of the great qualities that we've always known and loved about them. It may sound corny to say this, but some of my absolute favorite people that I've gotten to meet over the last 30 years have had Alzheimer's disease. And yes, they're impaired. And yes, they probably didn't remember the conversation they had with me later in the day, but they're just wonderful, delightful people. So let's not always just focus on the deficits. Yes, they're there, and we want to be understanding of that, but understand these are still our loved ones. They are still human beings. Treat them with the respect they deserve. Treat yourself with the respect that you deserve. And let me say one other thing. It's important as the family, the loved one, to take care of yourself as well. I used to include this in one of my talks, and it's true. Uh, we know that interventions that support, educate the caregiver helps the patient just as much as many of the drugs that I can prescribe, which then goes back to that whole idea that it's not just an individual with an underlying disease, it's an entire family that's connected. So the loved one taking care of themselves is not an act of selfishness. It's an act of compassion because that's going to improve the health of the one that we care about in the first place. So I'm sure I could ramble on forever, but I think those are some important things to keep in mind.
Absolutely, because sometimes you feel like you're drowning taking care of your loved
Yeah.
one. And, I see it in my family right now. It's hard. It's really tough. Last question, anything that we can do lifestyle wise, that can kind of avoid Alzheimer's or slow it down?
So yes, and this is also one of my favorite facts. Smart people much smarter than me, have now concluded that 45% of dementia is preventable. That is a huge number. And it's preventable through certain modifiable risk factors. And you can go into more detail, but it essentially boils down to this. First of all, getting good medical care, taking care of our vascular risk factors, things like high blood pressure, diabetes, cholesterol. What they say is what's good for the heart is good for the brain. That's absolutely true. So good general health care, being active, being active mentally, being active socially, and being active physically. The details may not matter, but doing all of those things, leading an active lifestyle helps limit those risks. And then diet, following largely plant-based diet, but something like either the Mediterranean diet or the MIND diet, both have pretty good evidence that they lower our risk for cognitive impairment or decline or dementia in the future. Sleep probably will be included in that. It's only a matter of time. And so it is fair to say we should try to get 7 hours of quality sleep a night. Of course, we're not all going to do that every night, but but that has not made it to that top level of recommendations. But I think there's a general sense it's coming. It's only a matter of time.
Yeah, that's something I think we can all improve on. I know I can. Dr. Cooper, always great to talk to you. Thank you so much for helping folks in our community, making us more aware. I really appreciate all your time.
It's a pleasure. Thank you.
All right, thanks.